October is Liver Cancer Awareness Month. Who is part of the campaign and what themes are being addressed in 2025?
So the topic of this year is liver cancer rights now. And so the liver cancer community, meaning patient organization and also scientific organizations, and anyone who wants to raise awareness. So what we want to do this year is to highlight the need for more intention at what is important from a patient point of view. And so the organizer of this campaign this year is ILCM, so the International Liver Cancer Movement. And it's an international friendship. It's not an organization, it's really a movement. And anyone who wants to take part of this campaign with us is for sure welcome. And we developed a series of tools that you can use with us to raise awareness.
Can you tell us about the recent publication of the Patient Charter?
Last year was really important for us because we developed a document, so a charter dedicated to patients with liver cancer. And this document is quite important and unique because, to our knowledge, it is the first one of that type which is available for patients with liver cancer. And this document also was a really nice illustrating the ability of working all together, because when we work on this document, we were around the table with patient representatives, scientific organization, and also company, because this document was funding by AstraZeneca. And if you look more in detail into this document, you will see that there is 7 principles that can be used to bring awareness and also to bring example to the policymaker. For example, the first principle is regarding national cancer strategy. What are we thinking of? We are thinking of, for example, universal vaccination for hepatitis B, because this is effective and it has been shown as reducing liver cancer incidence in some countries. The second principle is about early detection of chronic liver disease, but also of liver cancer. For example, we could think about national screening strategy for hepatitis B or C. For example, we have effective drugs for this, but also for HCC surveillance. And this is really important because when you are at higher risk of liver cancer, you should undergo ultrasound every 6 months. But unfortunately, only few percent of our patients are really having this kind of surveillance program, because the majority of our patients are diagnosed at a late stage. The third principle is about pluridisciplinarity, because we don't just have a liver cancer, we also have a chronic liver disease for the majority of our patients. So we need to consider all this with different experts when we are taking the decision. Then another really important principle for us is personalized care, because when we are thinking of a treatment, we really need to take into account the unique needs of the patient and to provide shared decision making, which is the fifth principle of the charter. And what also we think that it's really important is stigma. We need to work on stigma because it's not so easy to discuss about chronic liver disease and liver cancer, because it's about alcohol, obesity, drug user, for example. So we need to decrease all this stigma to be able to raise awareness of liver cancer and chronic liver disease. And for sure, the last principle is about fundings, because we need more fundings to be able to answer these different principles, but also to continue to provide research on liver cancer.
What policies must EU policymakers prioritise to reduce the growing burden of liver cancer?
So first, I would say that liver cancer incidence and mortality is still increasing. And that's why it's a major health issue. And the other point, which is really important, is that liver cancer is preventable. We have effective drugs. We can provide appropriate HCC screening, for example, that can link to early detection and to curative strategy. So we already have strategy and tools which are effective. And so the idea is to use this document, this charter, and also what was already done in other countries in order to improve the care of liver cancer, such as principle 1 to 3. But also we need to develop new strategy and to work all together on developing new aspects, new tools regarding shared decision making, stigma, because this is still not really developed. And so at the end, I would say that once again, it's a common work. We need to join our forces for this cause. And for sure, with ILCM, we are here to help you and to help you to bring awareness and to bring messaging in front of politicians. We have the tools, we are developing things, especially for the liver cancer month. So don't hesitate to contact us, and we will be really happy to help you to raise awareness for liver cancer.